what did you hold on to for inspiration?
So I think really our department was a real source of inspiration. Everyone really rallied together to make sure that our care for our patients didn't change and that our standard of excellence was met. And I think we came together in a way that would have been unimaginable prior to the pandemic. Just the sense of collaboration and togetherness that was felt was very different than I think what it was before. I think instead of being paralyzed by the stress or, the fear of what is to come, stress of the unknown, we really rose to the occasion and came together to continue providing high quality care. And many people, staff, healthcare providers went out of their comfort zone to provide this care, and sometimes were redeployed to areas that they were not familiar with, and still managed to rise to the occasion and work in that same high standard. So it was really incredible to see that. And it was also really inspiring to see many of our physicians in the department advocating for women in New York City who are pregnant in the time of COVID. What was also really exciting was to see how we were mobilizing the knowledge that we were gathering during this time and disseminating it out to other institutions and healthcare facilities, in the form of webinars or in the form of manuscripts or small personal correspondence, to let people know our experience, so that when their peak comes about,
Yes.
And when COVID-19 hits them hard, that they have our experience to work from, and to be as prepared as they can be. Obviously, the context may be a little bit different state by state, city by city, but it gives people more of a starting point and a sense of what could be. That was really inspirational. And I think the fact that this was all being done during a period where we were all very acutely aware that these were unprecedented times, and while we were doing all of this, we also had to continue not only taking care of our patients, but also taking care of each other and ourselves. Yes. So all of that within this context.